Module 2, Preparation for NCLEX. Passing the NCLEX is attainable for each nursing school graduate with the proper planning. That being said, the test ought to be viewed. Earning a straight A's or 4.0 GPA in nursing school doesn't foresee success on the NCLEX. Perfect time of starting preparation for NCLEX. We're sharing a few hints on when you should begin preparing for the NCLEX and how to get everything rolling. How early is too early? Even though you may not begin studying until nearer to the time you take the exam, it is never too right on time to start preparing for the NCLEX. Regardless of where you are on the nursing school timeline, everything you can manage to prepare is to familiarize yourself with NCLEX-style test questions. The more agreeable you are with the questions and testing styles you will see on exam day, the more it will assist you with being successful since quite a while ago. In most expresses, the earliest you can take the exam is roughly 45 days later than your graduation date. As I stated before, it's essential to take the Nursing Regulatory Board (NRB) license. Otherwise, you need to take a licensed state by state. Also, it will be a time wasting if you need to take a licensed shape by state. Decide for test timing when you want to take it. Various individual factors determine when a graduating student wants to enter the workforce, but this question, when would I like to begin my career, decides when you'll want to take your NCLEX. When you should start preparing for the NCLEX depends on when you take it. First, you need to know about NCESBN, the National Council of State Boards of Nursing. If you do not intend to take the exam within a few months or even a year, you need not be hurried. Indeed, it could be a valuable time of study with a top-notch test prep resource, so you are sure and ready on exam day. But most students are anxious to begin their life as practicing clinicians immediately. If you're looking to get everything rolling without a moment's delay, that 45-day mark is something to keep your eye on. It's vital to note that you can't simply show up to a testing community on an exam day and take the NCLEX. Before going for an exam, you need to follow a few steps. Pay the registration fees and register with Pearson VUE. Accept your authorization to test, ATT. For licensure, you need to apply the Nursing Regulatory Body, NRB. Plan your exam date with Pearson VUE. Start preparing about 6 months out. This is a great time to start studying again. You may not remember all your school study preparation, so you need to learn and review topics you may not recognize or recall now. To allow sufficient opportunity to audit the broad measure of information that will be covered on the NCLEX, successful candidates usually begin studying around 5.5 years before they are planned to step through the exam, which is presumably around the beginning of your final semester in nursing school. It's vital to note that the 5 to 6 month window for preparing is an idea, but every candidate is different. You realize your learning habits and study skills the best, so make sure to give yourself ample time to overcome all of the information. In addition, you need to make a timetable for the exam if you are slow in reading or writing. Time slots will help you give you confidence for the exam. How long can you remember learning from your school? You need to spend lots of time studying if you do not have a plan to take an exam in the next 3 months. One of the benefits of taking the NCLEX quickly upon graduation is that the information you have learned in nursing school is moderately new in your mind. Maintaining pertinent information might be a challenge for students who put off taking their exams. The challenging NCLEX-style questions, point-by-point reasoning, specific delineation and precise execution tracking will assist with reinforcing the information you have gained in your nursing system and increase your odds of NCLEX success. Do you feel confident that you have prepared? If you are ready enough, that is something worth being thankful for. You're going to do effectively. You risk getting a good result if you are not planning your time. So do you need to ask yourself if you are ready for this high-value exam? Whenever you take the exam 1 year after graduating or 30 days after graduation, this question will be huge for every candidate. The NCLEX is an adaptive computer test that measures your skill with each question asked. Each new question is more enthusiastically or easier based on your past answers. There is no issue with getting fortunate or anything on the exam day. Your insight level will be uncovered. The most fitting answer to how long should you wait to require for the NCLEX later you graduate is presumably this. It depends on you, but you need to make sure that you are fully prepared for the exam when you are taking the exam. Along these lines, how would you prepare your? Here are some essential steps. 1. Utilize flashcards with dispersed repetition innovation. 2nd, track your progress and take self-assessments to check your readiness. 3. Build a study plan and begin studying well ahead of your exam day. 4. Use superior grade, industry-leading practice questions. 5. Choose a test prep resource written by experienced nurse educators and practicing clinicians. I will give you 900 questions and their answers to make your preparation healthy for getting preparation. If you check all 900 questions in my book, you will surely get a good result in your NCLEX exam, because all the questions are from the previous NCLEX exam. How would I be able to get ready for the NCLEX? Feeling confident and ready for the NCLEX is significant, so knowing how to read up appropriately for the exam is fundamental. You will be facing a challenge in taking the exam of NCLEX. First of all, don't pack without a second to spare. Put in the legitimate energy, concentrate on the exam itself and how it works, and make a point to take heaps of practice tests. If you get all questions together, then it will be helpful for anyone. That's why in the last part of my guide, I added lots of questions. How to study for the NCLEX. Like any test, the critical component to success is planning. So you should foster a study strategy that works for you. Here are some study tips. 1. Study consistently, even in short 5 to 10 minutes bursts. 2. Maximize your time and study materials you are less familiar with first. 3rd, review all of your nursing textbooks. Then, take the module test alongside reading the module summaries. 4. Maintain a decent attitude and challenge yourself. Be determined that you can pass the NCLEX. 5. Purchase comprehensive NCLEX study materials that include practice tests. A few online websites with various resources accessible to nursing students studying for the NCLEX. You can download different materials for nothing that experienced nurses have written. The study materials usually include 4 comprehensive practice exams, like what you will find in the National Council Licensure examination itself, and section tests. Which subjects are covered on the exam? There is no chance to skipping the questions, and you need to go forward after answering the previous questions. This means you should spend some of your study time developing strategies for determining the best answer, even if the question is vague. The exam will have between 75 and 265 questions. Discover the explanation of how the exam is graded below to see why there is such a large range. Regardless of how many questions you answer, the following is the rate split of requests by content region. 17 to 23% questions will be about management of care. 9 to 15% questions will be about security and infection control. 6 to 12% questions will be about health promotion and maintenance. 6 to 12% questions will be about psychosocial integrity. 6 to 12% questions will be about basic care and comfort. 12 to 18% questions will be about pharmacological and parenteral therapies. 9 to 15% questions will be about decrease of risk potential. 11 to 17% questions will be about physiological adaptation. The exam could take up to 6 hours to complete. You have the option of skipping 2 quick breaks within that period. The amount of time it takes to answer each question is determined on the number of questions you must answer. For attending the test, how much I need to study? You ought to spend no less than several weeks reviewing all the material and working on your ability to recall realities rapidly. To do that, get the NCLEX RN Comprehensive Review, which gives an intensive breakdown of each content region, including all the essential terms and ideas you should know. To work on your outstanding ability on all that material, get a book of NCLEX RN Comprehensive Review. Repetition is probably the most effective way to retain a ton of information. Tragically, repetition can get, repetitive. You can prepare yourself within your expected way. It will help you to guide you from preparation to the exam end time.